Hi everyone, I'm Sarah Kunch, and my project is entitled Back on Track. It's the implementation of an intervention to prevent unsafe treatments for patients with back pain. The original project I found is entitled A Naturalistic Experiment Evaluating the Impacts of Medicaid Treatment Reimbursement Changes on Opioid Prescribing and Patient Outcomes Among Patients with Low Back Pain. The study was originally conducted in Oregon. At that time, Oregon Medicaid Services added coverage for non drug treatments for back pain, including counseling, physical therapy, acupuncture, chiropractic care, yoga, and massage. They also stopped coverage for steroid injections and for long term opioid medication to treat neck and back pain. The study hasn't finished. It will finish this month in December of 2023. Expected peer reviews should be out by March of 2024, at which time the results will be able to share with other potential locations. The expected outcomes include prescriptions for opioid medications, use of pain related healthcare services such as behavioral counseling, physical therapy, chiropractic care, acupuncture, massage, yoga, and exercise therapy, patient satisfaction with healthcare, harms related to pain related healthcare services, use of illegal or recreational drugs, and providers' experience with the changes in healthcare services. These can be measured qualitatively through patient surveys and quantitatively via patient records, opioid prescription tracking, and reimbursement data with Medicaid services. The potential success of treatment for chronic back pain without relying on opioids decreases the burden on health systems, promotes a greater quality of life for those living with chronic back pain, and could ultimately save lives of patients by avoiding substance abuse disorder. The original intervention did take place in Oregon, which was among the first states to enact strong measures to promote non drug treatments and prevent long term opioid treatment for back pain. If results prove to be successful, similar interventions can be implemented across the United States. To implement the study in Iowa, the approach must first be directed toward lawmakers and Medicaid representatives to encourage the expansion of treatments available for chronic back pain. Providing successful examples of a similar innovation, like the one found using the PCORI database, will strengthen the initiative to incorporate such services that highlight a non drug approach. Next, patients must be made aware of the available services, especially if they are not receiving further coverage for opioid medications, and they must seek an alternative route. Providers can then discuss options such as physical therapy, acupuncture, chiropractic consultations, and exercise therapy to patients to decide on an appropriate route. The desired implementation will take place in Iowa, which, like most states in the United States, has experienced opioid related deaths increasingly over the past decade. While recent mortality trends have linked such deaths to illegal drug use rather than prescription, the addictive tendencies of prescription medications and their progression into illicit drug use cannot be ignored. Curbing rates of further opioid addiction by removing the catalyst can shape the future of Iowa for the better. The target population for the implementation of the intervention includes those eligible for Medicaid coverage, and they are typically of lower income, and also patients diagnosed with chronic back pain. Evaluation will include a retrospective cohort study after 2 years of implementation. Data will be examined from before the implementation regarding the number of patients that were on Medicaid, those that sought treatment for chronic back pain, and those that were prescribed opioids. The initial data will then be compared to data sets 2 years later, specifically comparing the number of opioid related deaths per year, the number of prescribed opioids for Medicaid patients suffering chronic back pain, and billing statements issued for physical therapy and chiropractic visits. The evaluation will examine the outcomes as a number of opioid deaths per year as compared to baseline, either a rise or fall in opioid prescription dosages, and the number of patients seen at methadone clinics throughout the state as compared to baseline. Overcoming opioid addiction and promoting change cannot be done alone. Multiple agencies must be willing to participate to assist patient needs, explain differences in Medicaid coverage, provide options for alternative pain management treatments, and encourage support and communication among those affected by the change in coverage. Some stakeholders include patients dealing with chronic back pain, healthcare providers, Medicaid systems and their contributors, as well as emergency service providers. That can go on to include statewide community as well as families of those dealing with chronic pain as well. Having national support from Medicaid organizers, substance abuse organizations, and public health and government officials will also help to encourage participation and retention among patients and to ensure that this can become a nationwide program in the future. The social cognitive theory will be applied to the intervention to understand the influence of individual experiences and how they relate to decreasing opioid use. Highlighting self efficacy in this context will be an important step for doctors to encourage their patients to decrease opioid use and manage their pain with alternative approaches. Ensuring them of their capabilities to overcome addiction and adopt healthier treatment methods will push for success in the implementation as well. It is also important to highlight regulating individual behavior and how this plays a role in addiction. An individual must regulate their behavior and ignite motivation to change themselves, their behavior when overcoming addiction. The social cognitive theory will consider the environment of participants, their social influences regarding opioid use and treatment preferences, as well as the social norms associated with the different alternative methods discussed.